Welcome, everyone. Thank you for joining us today. I'm Teresa Marantat, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please continue to do your part to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when you cannot maintain a 2-meter distance from others. I will now report our current case counts. There are 156,961 confirmed cases of COVID-19 in Canada and 51,085 cases in Ontario. Chatham-Kent has 369 cases and Sarnia-Lambton has reported 346 cases. Michigan now has 123,633 cases, with 14,416 cases being in Detroit. Today, we are reporting a total of 2,663 cases of COVID-19 since March, an increase of 6 cases from yesterday. 4 are close contacts of confirmed cases and 2 are community acquired. 2,535 cases are now resolved and 52 cases are active and being followed by our health unit. 2 people are in the hospital. Our community has lost 76 people to COVID. 53 deaths have occurred among residents in long-term care and retirement homes. There is 1 retirement home currently experiencing a COVID-19 outbreak. With return to school, parents are reminded to continue to conduct daily symptom checks before sending their child to school. Parents are encouraged to use the ministry's assessment tool, which can be accessed through our website or ontario.ca. Symptoms of COVID can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, shortness of breath, nausea, vomiting, and diarrhea. Yesterday, 3 Shoppers Drug Marts in Windsor began offering testing for asymptomatic individuals by appointment. People with at least 1 symptom of COVID-19 should consider testing at an assessment center. Windsor has 3 assessment and testing centers: St. Clair College Sportsplex, Windsor Regional Hospital Elect Campus, Erie Shores Healthcare in Leamington, and Sohack in Windsor, where testing is available for First Nations, Métis, and Inuit people and their families. If you have symptoms and have been tested, you must remain home and stay isolated pending your test result. The health unit will call you if you have tested positive for COVID-19. Due to access online, you may receive your results before the health unit contacts you. Please continue to visit our website at ouiju.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. As you're all aware of, the provincial government has acknowledged that we are officially in the second wave of COVID-19 pandemic in Ontario. Ontario is reporting some of the highest single-day counts of COVID-19 cases since the beginning of this pandemic. Larger areas like Toronto, Peel, Ottawa, and York regions have seen the highest jumps in the number of positive cases with COVID-19, where active cases are now ranging from over 600 to over 1,000 cases active in the communities. Municipalities and local government businesses and employers must look at existing plans and strategies and ensure that they are prepared and continue to strengthen their efforts to protect the health and safety of workers and the public. We have already seen actions such as extension of the masking bylaw in the City of Windsor and the closures of bars after midnight. These type of measures and protection will need to continue and remain our new normal for quite some time. While in Windsor, we continue to report numbers in single digits as a region, but we have also seen and experienced how quickly that can change. Over the past few weeks and months, we have worked closely with our school boards to prepare for their reopening. Our school nurses have been responding to and supporting school principals, teachers, students, and parents. In the few weeks since school began, our nurses have responded to a number of questions from parents and school regarding COVID-19 screening and guidance. To assist parents and school administrators, we have created the simple flowchart. I'll just quickly walk you through with this flowchart. So as many times we are asked this question, what to do if your child has symptoms of COVID-19? So it can be two possible scenarios. Your child can be at the school or your child can be at the home. If your child is at the home, obviously you will do the COVID online self-assessment, and based on those self-assessment, you are provided direction whether you need to go to the primary care provider or whether you need to go to to an assessment center, or you should stay home. Child at school, the school will call you. At the moment, if they pick up anyone who has any symptoms or who has concerns, the school will contact the parents, whoever is the designated person to be contacted. And then the parents would be asked to have their child assessed by a healthcare provider or go to the assessment center. So in the situation, if you go to your primary care provider, and if your primary care provider gives you an alternate diagnosis, such as, for example, if your child was having a headache, but then the reason could be migraine or could be something else, then they are giving you an alternate diagnosis. And based on that alternate diagnosis, once your child's symptoms resolve, you can return to school. If your primary care provider is recommending a test, then you are to take your child to the assessment center. And then based on the test results, whether it comes back positive or negative, you will have to go through certain actions. Obviously, if it's a positive, the local public health unit will contact you immediately within 24 hours of notification, and then we will send an exclusion letter to the school for your child. In case your child comes back negative, but if your child did not have any high-risk exposure, they can return to school within 24 hours of symptom resolution. If your child had a high-risk exposure, they may be required to stay in self-isolation for up to 14 days. If your child is not tested, or if you don't want to go get your child tested, and there is no alternate diagnosis that is provided to you by your healthcare provider, in this situation, the child and all the household contact must self-isolate for 14 days from their symptom onset date. So that's just the general walkthrough that we have worked through to help parents understand, help school boards understand what to do in case if a student develops symptoms in the school setting. This document would be available on our website. This information should guide parents and school administrators to take action when children become ill with symptoms of COVID-19. It will be posted to the school section of our COVID-19 homepage and should be considered as a companion document to the provincial school screening document and guidance for management of COVID-19 in school settings. Thank you.
The conference is now unmuted.
We'll now take questions from the media. We'll start with Blackburn.
Hi, good morning. I guess just based on your chart, I've been, seeing things from fellow parents and things like that. So if you have two children, one of them has symptoms, the doctor has said, no, you don't need to go get tested. It's, a cold or whatever. Or I guess cold is not a good example, but they have an alternate diagnosis. Does the other sibling have to stay home, or can they go to school if they have no symptoms?
Well, obviously, if there's any alternate diagnosis that is provided, that means the child is there, the physician is of the opinion that the child may not have COVID. So in that case, yeah, they could have any other type of infection. So the child may stay at home, but the sibling do not have to stay at home unless they are also symptomatic.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. We heard Dr. Tam and other public health officials suggest limiting our social interactions because of the second wave. The city of Windsor is reopening recreation centers so clubs and teams can use spaces again. What's your advice to people in our community about rejoining, hockey clubs or other sort of recreational teams?
Thanks, Katie. Well, our advice has been pretty much similar, that we recognize that that there is this need for social and mental well-being of people, and engaging in physical activity that is also an important part of your overall health. So recognizing that so many individuals will choose activities that they like to do or they prefer, but doing it safely. And all these recreational facilities, all these sports league, they have a full protocol that they have to follow to ensure the safety and well-being of everyone who's coming in and participating in those facilities or in those activities. If you are a high-risk individuals, if you have any health condition, obviously then the recommendation would change. But overall, in general, what we are saying is, at this time, especially given our local epidemiology, we're not asking everyone to just stop doing everything and just stay home. We're not there yet, and hopefully we shouldn't be there. But the only way we can feel safe or feel more comfortable is to follow the recommendations, which is obviously the ensuring that you are maintaining your physical distance at all times. You are following all the protocols of washing your hands, using the equipment in the right possible way, not sharing the equipment, and doing it responsibly. So all full details of all these recommendations obviously are available on our website, and also every facility have their own protocol as well. They will have their markings, they will have their guidance, which amenities you can use, which you cannot, and if you're doing it, what's the protocol. So please follow all those guidelines. We're not saying that you should not participate, but do it safely and ensure that everyone is safe around you. And obviously, most importantly, stay home if you're sick.
And is it possible to maintain a social bubble while playing a close contact indoor sport?
Well, I think it really depends again in the entirety of that context, and if your sport takes you into the situation where you may be invading personal spaces, then obviously you will have to take that into consideration, that how you're interacting with, who you're interacting with, and if you have a set group of people that you are playing with. Ideally, it's you should avoid physical contact or coming in contact with anyone if they're not part of your household, but recognizing that there may be a situation where you may do that, so making sure that you're doing it responsibly.
Thank you.
Any questions from AM 800?
Dr. Ahmed or Teresa, I'm not sure who this is for. When it comes to our assessment centers for testing, do you have, I know it might be a hospital I have to ask, but how has the numbers been? I saw the past couple of days in London, they're reaching capacity like by the noon hour. Are we seeing numbers like that in Windsor-Essex?
Yeah, I don't have the numbers for the assessment center, but I can check on that. I know the waits are a bit longer now than they have been in the last little while, but I'm not sure of the exact numbers other than what we reported last week, approximately 700 a day across all the assessment centers and all the testing in Windsor-Essex County.
Okay, and then Dr. Ahmed, I know you talked about the students, but let's say for an adult that's going to work, if someone wakes up and they have a runny nose or a scratchy throat, like what would you recommend to them? Would you recommend them go get a COVID test or see if the symptoms are there if the symptoms linger for a couple of days? What would you recommend for an adult that has to go to work?
Well, the recommendation is still it's exactly the same. So first of all, if you have a symptom, which could be of a COVID, then you should consider going for testing. In any case, if you are sick, if you have symptoms, you do not go to work. Either you stay and then you wait until the symptom resolve, or you go and get tested. And sometimes what I think the key piece is, if this is an unusual or new symptom for you, or versus is this something that's normal? So for example, if someone waking up in the morning with allergies and sneezing and coughing, but that's normal, that happens every time this year. So then that's different than someone who never had that, but now they're having these symptoms. So I think the short answer is, if you have symptoms, you stay home. And if you have symptoms that could be consistent with the COVID, if you have run the self online testing, if it's recommending you to go and test it, please go and get tested. And that's the only way we can stay on top of it, instead of someone taking a chance with their symptoms and going out and potentially infecting other people. And then those people, if they don't know what they are dealing with, they can potentially infect other people. And very quickly, we can have a large number of cases in our community. So the responsible thing would be, if you have symptoms, stay home and do the online testing. If it directs you to go for the swab, please go and get tested.
And I think you mentioned this before, and that's going to be the difficulty with flu and cold season here. The symptoms are very similar. So there's obviously going to be some difficulties moving forward.
Well, recognizing that's the challenge, and we encourage that if you have those symptoms or if you suffer from allergy in this time around, please talk to your primary care provider and maybe get some medication or some suggestion that how you would deal with that. And then the message, as I said earlier in my last response, if it's a new symptom or if it's something that you experience pretty regularly, and that's the other distinction. But the best option is, especially if you have some kind of a chronic condition, whether it's you're talking about allergies, talk to your primary care provider and have a plan in place that how would you deal with this allergy, especially in this time, and maybe even in the past you may have not you haven't taken any medication for that, but maybe this year please consider that, at least just in case, so that you're not mixing those two symptoms together.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, doctor. Just going off what Katie asked you, are recreational leagues required to adhere to the 10 and 25 person gathering limits set for social gatherings, or is it separate? I don't recall that specifically, but my team here is telling that I think it follows the same recommendation in terms of the cohorting with the 10 and 25. So they have to follow all those guidelines specifically, and then maybe just alter how they play and how they interact with. Okay, so theoretically, if you had more than 10 people participating in an indoor sporting activity, if some of the people stayed separate until they were on the field, would that be appropriate? Yeah, and again, it really depends on the size of the facility too, right? So the gathering limits with 10 and 25, it's very specific for the social gathering, which is not for the recreation purpose, but just to get together and eat and laugh and talk to each other. But I think these type of activities would be excluded from it because this is not a social gathering, it's a recreational activity that they're participating. But still, the concept of limiting the number, ensuring that appropriate physical distancing is possible, that needs to be followed. Thank you.
Any further questions from Blackburn?
No, thank you.
CBC?
No, thank you.
AMA 100?
I have one, but it's not from me. It's from Bob Belichico. He couldn't make the call today. He wanted me to ask Dr. Ahmed a question. Dr. Ahmed, he just wants to get your thoughts on the testing beginning at Shoppers today and other pharmacies in Windsor.
Okay, so thanks, Bob, for the question, but I will pass this question to Teresa to answer this.
Testing started yesterday at 3 Shoppers in Windsor, at Devonshire Mall, Tecumseh Mall, and one on Huron Line. We did verify that it's asymptomatic, people without symptoms. Shoppers, you must call the shoppers that you're planning to attend for an appointment, and they do a little, get all your demographic information. We were also advised that a health card will pay for the test in Ontario if you present a health card. If you do not have a health card, there is an option to pay for the test out of pocket. But other than that, it started yesterday and is available at, like I said, those 3 Shoppers Drug Mart.
By appointment.
By appointment.
Teresa, by any chance, do you know what the numbers were like yesterday? Did they see a good response?
We didn't ask that. We were trying to ascertain how you access the testing at Shoppers and if you needed an appointment, but we didn't ask how the numbers were. We were just told it started yesterday. I know it was announced yesterday, but we'll look into how the response is and what that's going forward.
Okay, thank you. Well, thanks for Bob. Sorry.
Any further questions from the Windsor Star?
No, thank you.
Thank you, everyone.
Thank you.